Semakin berusia, pergerakan mungkin semakin sukar. Kajian menunjukkan orang yang minum 2 gelas susu dengan MFGM dan nutrien penting mengalami 40% peningkatan dalam jisim otot, 3 kali peningkatan dalam keseimbangan, 2 kali peningkatan dalam fleksibiliti. Anlene Gold 5X dengan MFGM aktif, kalsium, protein, kolagen dan vitamin. Nikmatilah kebaikan Anlene Gold 5X. Sekaranglah masa terbaik dalam kehidupan anda. Semakin berusia, pergerakan mungkin semakin sukar dan ketinggalan saat bermakna apabila kepadatan tulang dan kekuatan otot berkurangan. Anlene Gold 5X baharu dirumus secara saintifik dengan MFGM aktif, kalsium, protein, kolagen dan vitamin. Nikmati kebaikan Anlene Gold 5X. Bergeraklah dengan fleksibiliti dan tenaga hari ini. Nikmati saat bermakna dengan kebaikan Anlene Gold 5X.
welcome to a very special talk show brought to you by ReGen Rehab Hospital and Anlene Malaysia. Now this is in conjunction with World Osteoporosis Day that falls on 20th of October every year. Now the campaign that the team has brought to you today is called Sound Bones, Sound Health. Now this is part of a 2 series where we will raise the awareness on the importance of bone health through rehabilitation and important dietary habits that you need to take to keep your bones and muscles in good health and condition. Now my name is Nazierah and I will be your host for today, and today's series is the second part where it is titled How to Guard Your Bones. Now without further ado, let's get right into it. A special hello and welcome to those of us joining from Facebook Live. Welcome to the talk show today. We are so happy to have you here. Now, if you have any questions or comments, you can write them in the comment box down below and we will do our best to answer it. Now, I am excited for the talk show today because we have a panel of experts. For today, we have Dr. Ramani, which is the consultant rheumatologist and internal medicine physician from ReGen Rehab Malaysia. We also have Miss Deshitha, which is the senior physiotherapist from ReGen Rehab Hospital, and we have Miss Liew, which is the assistant nutrition manager from Fonterra, Malaysia. So welcome to the panel of experts that we have today. Wow, the number of viewers tuning in is amazing. So guys, please do ahead and keep it coming. And remember to invite your friends and family to like and share this live session as well. Now guys, we also have a special treat for you. Today you can stand a chance to win amazing giveaway and prizes worth up to 550 ringgit. Now to stand a chance to win this giveaway, all you have to do is just answer one simple quiz at the end of each panel expert session. So if you want to know how to answer them correctly, be sure to remember to tune in to Dr. Ramani, Ms. Deshitha and Ms. Lie's session to get the right answer. So stay tuned. Now without further ado, let's proceed to the talk show. Now our first speaker today is Dr. Ramani. Hi Dr. Ramani, welcome. Thank you so much. I'm good. Thank you so much. Thank you so much for joining us in our session today. Now if you could please briefly introduce yourself to our audience on what you do in ReGen Rehab Hospital as well as your experiences.
Thank you for having me here today. My name is Dr. Ramani Arumugam. I'm a consultant rheumatologist and internal medicine physician. So I do specialize in all diseases of rheumatology, but one of the areas of interest is osteoporosis. World Osteoporosis Day falls on the 20th of October every year. And in conjunction with World Osteoporosis Day, we want to run this campaign of Sound Bone, Sound Health. So I'm International Osteoporosis Foundation certified in the reading of DEXA scans and osteoporosis management, and I used to run the osteoporosis clinics in the UK. So we would like to prevent osteoporosis and we would like to educate people regarding their bone health by having an education talk like this.
So doctor, as I know, bones are an important part of our body as it helps support us to allow us to move freely. In fact, good bone health enables us to live better quality of lives, correct? However, our bones can also break when we least expect and cause other related complications like reduced strength and movement. So I'm pretty sure the question that is in everybody's mind today is, what exactly is osteoporosis, and does a patient with osteoporosis show any symptoms?
Okay, so osteoporosis is when the bone becomes brittle. It gets thinned out for whatever reason. It could be age-related, it could be due to certain drugs, it could be due to certain diseases. So the bone gets thinned out, and usually there are no symptoms until a patient presents with a fracture. So what we are trying to do is to educate people to take care of their bones so they don't come in with a fracture, right? So 1 in 2 women and 1 in 5 men will get a fracture after the age of 50 if they have osteoporosis. So we want to prevent that.
All right, doctor, hearing what you have to say, why should we care about osteoporosis since it doesn't show any symptoms?
Right. So what happens with osteoporosis? Most of the time there's no symptoms. So people don't really take the effort to care about their bones. And what happens is when they fracture, they come with a lot of morbidity and mortality. So in 1997, there was a study done by the Malaysian Orthopedic Society, and they calculated the cost of hip fractures, right? And they found it cost them about 22 million ringgit per year. And this is not taking into consideration the nursing care, the mortality, the morbidity, and the physiotherapy and nursing care. And also it was underreported. So if you fast forward to 2022, the cost will be exponentially higher, right? And those who fracture their hip, 24% do not survive, right? And the reason they don't survive, if you don't treat the hip fracture within a year, patient is bedridden, cannot move, they develop bed sores, they develop lung infections, develop deep vein thrombosis that can cause a lot of problems. On top of that, you need people to take care of them. So the cost is increased because of that. They need nursing care, they need physiotherapy, they need someone to take them to the physiotherapy and things like that. If a patient were to fracture the spine, then of course they have loss of height, they cannot look straight, they are uncomfortable, they cannot lie down properly, they are in pain. So all this, causes a lot of problems. So we'd rather do preventive action in taking care of your bones so you don't land up with osteoporosis.
Yeah, and that speaks volume to that saying, prevention is better than cure.
Yes, correct.
Now, I've also actually heard about peak bone mass, and I'm sure some of them in the audience have also heard about that term, but can you enlighten us a little bit more about what that exactly is?
Okay, so when we are born, we start to grow, and of course our bone grows with us. It peaks at puberty. So if you have good nutrition, good exercise, what happens, your bone mass is adequate so that after the peak, it starts to go downhill after the age of 30, and when you hit menopause, it goes down drastically. So if you start at 10% higher peak bone mass, you prevent fracture by 50%. So the nutrition during childhood to puberty is very important, with diet rich in calcium and vitamin D. Of course, men have a higher peak bone mass than women in general, so they tend to fracture later. Right? Okay, so that's peak bone mass. So if anyone is in the audience listening, so for your children or your grandchildren, it would be good to make sure their diet is adequate with calcium and vitamin D.
Now, speaking of calcium and vitamin D, right? What is the adequate intake of calcium and vitamin D in a day for a person? Okay,
so calcium obviously we get from foods. The nutritionist later will go into detail regarding what foods are high in calcium and things like that. So the daily requirement should be 1 gram of calcium per day, 1 to 1.2 grams of calcium. Now, calcium, if you're taking supplementation, make sure you take it in the morning and you drink lots of water, because the tendency is if you take it at night, you might get renal stones. Right?
Okay, so it affects your kidney.
Yeah, so make sure you take it in the morning, drink lots of water so you wash out everything and keep active. Now, vitamin D, the total daily requirement varies according to your age group. So if you're postmenopausal or elderly, you can go 800 units to 1,000 units. So I know there are some people who get vitamin D supplementation from other countries, and sometimes they tell me to take 3,000 units, 5,000 units a day. That's a bit too much, because you can get vitamin D toxicity. Now, vitamin D is usually got from the sun, and the recommended daily exposure to sun would be early morning sun, 20 minutes a day to hand and face.
Would that be the best type of sun?
Yeah, that would be the best type of sun. But I did a study more than 20 years ago on postmenopausal women, and we checked the vitamin D status, and 87% had problems with their vitamin D. although
lacking?
although we live in in a hot
country.
hot country, but you have to remember, most Asian women wear a lot of makeup. We do not go out in the sun.
And
we don't want to get dark.
Sunscreen.
Yes, we don't want to get dark. You see, so we sit in rooms behind shaded glasses and things like that. So of course your vitamin D levels would not be high, and the darker skin you are, the more chances of not absorbing the vitamin D, because melanin protects against skin cancer, but also prevents absorption. Right? As you grow older, your skin tends to get thinner, so the absorption gets less. Right? And also, when vitamin D goes into your body, it needs to be activated by the kidney and liver before your body can utilize it. So calcium and vitamin D are building blocks for your bone. So if you have vitamin D that's low, your calcium cannot go into the bone, and of course then you tend to thin out your bones, right? So it's a good idea to check your vitamin D level once a year, and if you need supplementation, to supplement it. If you're elderly, in a nursing home, not moving about much, then you should supplement whatever your vitamin D level is, right? Because you're not getting that much exposure to the sun. And if you feel your diet is inadequate with calcium, then you should also take calcium supplementation.
Thank you, doctor. I'm sure the audience is also taking note on how much vitamin D and calcium that they need daily and how important it is in our diet. Now let's bring the topic back to osteoporosis. Can you tell us a little bit more about what is the process and physiology of osteoporosis? Okay,
so basically we have two cells in our body that deal with bone. So we have the osteoclast that remove old bone and damaged bone, and we have the osteoblasts that grow new bone. So the process in which the old bone is removed is called resorption, and the process where new bone is formed is called absorption. So obviously you need building blocks, right, which is your calcium and vitamin D. So let's say your calcium and vitamin D are normal, then your osteoblasts will take that calcium and vitamin D to grow new bone by the process of absorption. However, anything can cause a decrease in absorption and increase in resorption. Menopause being one of them, autoimmune disease, steroids, diabetes, any disease can cause that, right? So I'm going to give you a story about a young man of 45 years of age. He's a banker and he travels a lot, and he came in because he was referred for gout actually, right? And what happened was his uric acid levels were not that high, but he kept on having repeated renal stones, and what happened is he had torn his ACL and gone in for surgery to repair, and the orthopedic surgeon noticed that his bones were a bit friable. So they did a DEXA scan and found out that he had osteoporosis. So we had to investigate further, because a young man of 45 years of age shouldn't have osteoporosis. So we need to look for secondary causes of osteoporosis. And so we found out that he had hyperparathyroidism, which affects the calcium vitamin D pathway, and that's the one causing the calcium to come out from the bones and form kidney stones, and also to get osteoporosis. All right, so we have so if you have any men who come in with osteoporosis, we need to look for secondary causes, right? Then we had a 75-year-old lady who had back pain for a month. She went to see the surgeon, and the surgeon referred her to me, and when we did an x-ray, we found that she had 2 fractures, okay, on the spine. So what we did was, we did an MRI to see which fracture was new. And one of the fractures was new, and one of the fractures was old, but she never had any symptoms from the previous fracture. So we assessed her by doing a DEXA scan, and we found that she was osteoporotic, and we treated her, and of course success story, right? She had no more pain, and the treatment improved her bone fragility scores, right? Now, so it's always good to get assessed before you have a fracture, So if you're postmenopausal, you have diseases like hypothyroidism, diabetes, you have family history of osteoporosis, it would be a good idea just to do a general checkup and do a DEXA scan and see where you are. If you are normal, then you may repeat the DEXA scan 2 years later. If you are already osteopenic with risk factors, you might want to repeat the DEXA scan in a year's time and reassess the situation. Of course, making sure that you're taking care of your bones.
Now, hearing about all these cases, some of them with positive outcomes, I would like to also know, and I'm pretty sure the audience will also are curious, about how can we, in a nutshell, take better care of our bones?
Okay, so we go back to the basics, right? So diet, rich in calcium, vitamin D, exercise, weight-bearing exercises, right? And of course, regular checkups, right? So as long as you do this, I think you should be okay. The nutritionist will go into more detail and the physiotherapist will go into more detail regarding the diet and exercise. So whenever you come to see me, the first thing we do is a fall assessment risk. So if you have difficulty getting out from your chair without support, you are taking more than 4 medications at one time, you have diabetes or hypothyroidism, you have a history of falls, right? If you have a lot of these risk factors, you need to look at why you're falling and you need to do preventive measures to prevent falls, right? So that would be by exercising and improving your muscle strength and also eating properly.
Thank you so much, Dr. Ramani, for that insightful sharing. I'm sure the audience learned on how they can better take care of your bones, as well as the dietary requirements required to have better bone health. All right, guys, let's begin today's mini quiz with our first question. And the question is, listen carefully. What is one symptom of osteoporosis? Now, if you did not get the question, I'm going to repeat it one more time. The question is, what is one symptom of osteoporosis? Now, if you were listening carefully, you would know the right answer. Please write the right answer in the comment box down below, and you can be one of 3 lucky winners to take home prizes worth up to 550 ringgit. The next panel of experts that we have today is Ms. Deshitha. Now, Ms. Deshitha will show us what activities and exercises that we can do at home to promote better bone health. Now, without further ado, let's bring up Ms. Deshitha.
Hi, I'm Deshitha Kasipile. I'm Senior Physiotherapist at ReGen Rehab Hospital. I have 12 years of experience in this field and I'm specialized in musculoskeletal and neurology. So today we're going to talk about the exercises that all of you can be doing for your osteoporosis or to strengthen your bone density. So I'm going to show you a few exercises that can be done in a seated position and later on standing position. So all you need is very simple things. If you don't have a dumbbell at home, that's fine because you can even use a mineral water bottle. Alright, a small 500 ml mineral water bottle is actually okay. So I'm going to show you the first exercise. This is called the bicep curls. You're going to place your elbow, it's going to be bent and you're going to place it at the side of your body. It's going to be fixated. Alright, so you're going to bend it this way and extend it all the way down. Alright, you're going to repeat that a few times. So we're going to do a 10 repetitions, okay, and we're going to do it slowly. Let's go. Let's do it together. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, so depending on the repetitions of how much you can tolerate, you can do according to what you're doing. So for those who are beginning with starting new set of exercise for the first time, then you can take it slow. Perhaps one set of 10 repetitions would do. So if you're going to do both sides, that's okay as well. As long as you are all right with it and you're able to do it, then go ahead and do it together. Okay? And the next exercise is called the tricep dips. You're going to bend your elbow back, okay, and you're going to straighten the elbow upwards that way. All right? So let's try that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so for those who are very comfortable with the exercise and they don't feel so much of difficulties performing it, you perhaps could do a heavier water bottle, the small bottle. You could actually add up more water in it, and if you want to intensify that, you could even increase the repetition. Let's say if you're doing a 10 reps of one set, you could do that 20 reps of 2 sets. Okay, so moving on. Now let's move on to something else. This is called the resistant band. All right, you can get this anywhere in any physio department, so they have it. You even can get it in the pharmacy places where some of that place like Fitness Fit, Fitness First and all, you can get that as well. So you can actually modify it the way you want it to. Okay, supported in the other side of the leg, and you can just pull it upwards. Okay, and this, you're working your upper limb as well. All right, and you can just do as many times as you can, and that's it. All right, so you can do on the other side. So if you're changing sides, you're going to put it on the same side of your leg, and you're going to put at the opposite direction. All right, so again, we're going to do a 10 reps, up to you, 20 reps also can, as many times as you think you can afford to. All right. All right, okay, the next one, the simple one. All right, this is more like a chest press in a very simplified version actually. So anyone can do this. It's very easy and it's very, very effective for sure. All right, and that's about it for your upper limb. So now moving on to the lower limb, you still can use the resistant bands. Actually, this is really beneficial because there's a lot of exercises that you can do with it. Even if you're progressing forward with advanced exercises, you still can be using this resistant band. And there's many types of the resistant bands. They have the lighter weights up to the heavy weights. So if you're progressing, and you can really change whatever that suits you the best. All right. So one exercise that I think is really good, that all of you should be trying out as well, is for your hip. Okay, you can bind it together, tie it around, and opening up your hip. All right, this was very well for your hip abductors. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. As simple as that. Okay, the next one, a bit more different. Okay, we don't need to use this resistant band. For those who don't have anything at all to use, maybe, you know, if you're not going to get a resistant band, you can try this at home. So when you're doing this exercise, make sure that you are out of the chair a little, so it's easier to move. Okay, it's called the seated marching. All right, this is a very effective exercise and it's very simple. You can even do it while watching the TV or while you're reading a book. It's as simple as that. All right, all you have to do is march. So when you're doing this marching exercise, make sure that you're stomping hard, okay, so that you get the feel of the floor, right? That's about it. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So that's about it. So this is one effective exercise, and there's another one where you could do sides, opening the sides and stomping your feet in and out. All right, open your side. So this exercise is not only to strengthen, but it helps to stretch as well, because when you're opening up your leg, you're actually stretching your inner thigh muscles. Okay, that's good for your flexibility. So when it comes to exercising, it's not only important to concentrate and focus on strengthening, it's also important to stretch, because stretching is a very important thing that all of you should be doing on a daily basis. All right, so now that we are done with seated position, shall we try the, oh yeah, before I forget, there's one more thing that we could do in seated position where they call the taps. this exercise, it's not only good for your blood circulation and all, it's also good for your coordination. So as we age, balance, coordination is something that slowly kind of like decline. So this will help you to, actually look into your coordination and see, if you need any more looking into it, or if you need to enhance your coordination, or if you think that it's okay. So that helps in a way lah. So all you have to do is just tap like that. Okay, if you want to make it a bit difficult, you can do it a bit faster, but that will be one good exercise to try on as well. Okay, now moving on, in standing position. All right, so in standing, we have a few exercises that I would like to show you. The hip exercise. One is lifting the hip forward, keeping your hip a bit bent. Okay, it's called the hip lifts. So to make it a bit more challenging, you could actually hold on to a count of 5 up to 10. All right, so if possible, I want you all to hold on onto a chair that's sturdy and not flimsy, so it's safer that way, because if something that really moves and gives way, then it will get a bit difficult. All right, so you're going to lift up, hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and down. All right, so you can do both sides the same. 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, so moving on to the second one, hip abduction. So when you are doing this exercise, remember to keep yourself upright. Okay, so when you're bringing your leg to the sides, you are making sure your knees are locked and it's straightened. Okay, you don't want to keep your knees bent that way and lifting it up. So this way you're not actually doing it correctly. All right, so make sure your spine is upright. Okay, your posture is correct, and your hip and your knees are in a aligned position, and you're lifting it out as much as you can. Okay, so if you want to make it a bit more difficult, you're opening it up and holding it up to 5 or to 10 second count and down. Okay, now that we have done the front and the side, another one for glutes, extending to the back. Okay, so the same thing, you're keeping your hip and your knee straight, and you're bringing it back, keeping your spine upright and maintaining that for 5 to 10 seconds, as much as you can tolerate, and then repeating that. All right, and not forgetting, earlier we did the seated marching in sitting position, and that can be done in standing as well. So if you're doing it in standing, and if you think that you are off balance, make sure that you're supported and you're holding on to something sturdy, and you can do that marching. All right, and including the previous one where we have that opening up to the side, you could do it in standing as well. So make sure when you're doing this exercise, you're able to move freely so that you don't get hurt, or there's no any restrictions at the side that can limit your movement. Okay? So just before I leave, I would like to remind you of something, that when you're doing all of these exercises, remember to breathe in and out as usual. So I mean, it might be a bit funny, but actually most of us, when we do exercises especially, I have seen my patients, they tend to hold in their breath and not breathe and hold up that, and that's not what we advise you to do. So as much as you're doing the exercise, make sure you do your breathing exercise as well. It's very important, and that will give a lot of difference as well. So, and also another thing, when you're doing these exercises, make sure to watch out with your posture. A good posture is really important, because if you don't take care of your posture, you'll end up having other back aches and pains. So that's one thing to take into account. And lastly, if you're doing all these exercises and you tend to have pain or discomfort, please stop the exercises immediately, because in spite of being the most safest exercise to do, these are very safe to be done at home or anywhere for everybody, despite their age. So even if you happen to have pains and aches, stop it immediately, consult your doctor and go see a physiotherapist. So that's all from me. Back to you, Naz. Thank you.
Thank you, Ms. Deshitha, for showing movements that we can do at home to strengthen our bones and movement. Now let's move on to the second quiz of the day, where you guys can stand a chance to win amazing giveaways. Now the question is, name one activity or physical exercise that you guys can do to strengthen your bones. Now if you were paying attention during Ms. Deshitha's demonstration, you will be able to answer this super easy. So write the right answer in the comment box down below, and you can be one of 3 winners to take home prizes worth up to 550 ringgit. Now, what are you guys waiting for? Be sure to write the right answer in the comment box down below and let me know the one activity or physical exercise that you guys can do to strengthen your bones. Alright guys, now that we know how important movement is to our bone health, we must not disregard the role of our meals in our bone health. Now you guys know the famous saying, we are what we eat. So I have here Yen that will answer some of the burning questions on dietary requirements for healthy bone and muscles. Now, my first question is, what are some of the important nutrients that we need to take for healthy bones and muscles?
Thank you, Naz. That's a good question, Seth. Actually, for us to care for our bones and muscles, it's important for us to take a balanced diet by including important nutrients such as the calcium, which is important for bones. It helps us to build and maintain strong bones, and also vitamin D that helps to absorb calcium absorptions, which is also important for bones. So for muscles, we need proteins. Proteins help to build and repair body tissues, including our muscle cells.
Alright, now I think my second question would be, are Malaysians taking enough of these nutrients?
Okay, when it comes to bone nutrients, say for example calcium, did you know that many of our Malaysian adults are actually not taking enough calcium on a daily basis? You know, actually our bones are the storage for the calcium. If we're not taking enough calcium on a daily basis, our body will take the calcium from the bones, putting us at risk of getting poor bone health. And on top of that, actually Malaysians are also not taking enough vitamin D. Vitamin D is important to help with calcium absorptions.
Now Yen, I think I would also like to know what food contain these important nutrients.
So just now I mentioned about calcium. Actually calcium-rich food, you can get it from products such as milk, cheese, yogurt as you can see from here, and also in other plant-based foods such as dark green vegetables such as broccoli, kailan, and also tofu from plant-based sources. So for vitamin D, actually it's very hard for us to get from our daily diet. Some of the vitamin D sources including egg yolk, vitamin D fortified milk products such as our Anlene Gold and also Anlene 3X as you can see from here, and also fatty fish including salmon and also tuna. So those are the food sources that we can get from our daily diet.
Alright guys, I hope that you are including the food that Yen mentioned into your next grocery list. Now, as you guys can see, we have a lot of yummy ingredients in front of us brought to you by Anlene Malaysia. So without further ado, let's take theory into practice with this yummy recipe that you can do at home.
So today I'm going to share with you all strawberry banana smoothie. So all we need is just 5 simple ingredients. So as you can see from the table, we have a list of ingredients here. What we need here is half a cup of strawberry, 1 banana, 2 tablespoons of our Anlene milk powder, about 100 ml of cold water, and finally 1 cup of our Anlene yogurt. So it's very simple to make this smoothie recipe. So Naz, I need your help. So first of all, we would like to put half a cup of our strawberry into the blender. We may need
to open this up, put this aside. Then I'm just going to pour some of these strawberries inside.
Strawberry is a good source of antioxidants, high in vitamin C as well.
Alright, what's next?
So what's next is another fruit that we're going to have, which is the banana.
Okay. Now banana is a good source of calcium, right?
Banana is a good source of potassium.
Potassium. Alright. Okay,
so we're just going to put in all the banana that we have cut into the blender.
Okay. I'm just going to put it into the blender. Seems like a very easy recipe to do.
Yeah, it's a very easy recipe to do, and then you can take it, say for example, a quick breakfast menu as well.
Right.
So next we have our 2 tablespoons of our Anlene powder.
Okay.
And then also 1 cup of our Anlene yogurt. Let's just...
Alright. Ooh, it smells super yummy. Can smell it from here.
So we are using our Anlene plain yogurt, which is also a high calcium yogurt as well.
Okay.
Last but not least, our cold water.
Alright, so I'm just going to put it in.
Yeah, so we just put everything in.
Seems very simple to do.
Very simple,
quick and
right?
Easy. Yeah.
And it's easy to learn as well, and the ingredients is easily available as well.
Alright.
So what we need to do is just press the button and keep it blend for a few minutes.
Now the fun part comes.
So this is a simple and easy to do recipe for all of you. So it is it can be an ideal breakfast idea for you, whereby just early in the morning you can just cut some of your favorite fruits, yeah? Apart from strawberry or banana, you can also add some of the other fruits that you like, or even you can add some nuts inside there to make it your perfect breakfast that you like. Yeah, so it gives you, by using our Anlene milk powder, it gives you the calcium, proteins, vitamin D that you need for your day, to kickstart your day. So there you go, a simple smoothie recipe from Anlene.
Alright, now we are done blending. So I'm just gonna take it out. Ooh, it looks super yummy. Yeah, okay. So I'm just gonna put this at the side. Then I'm just gonna pour some here into these Anlene cup. Ooh, guys, it looks so yummy. And we're gonna finish it up with the strawberry touch. Thank you, Yanli, for this quick and easy recipe that people can do at home in less than 5 minutes as a supplementary for your breakfast, right? Yes. Now, the giveaway question is, what are 2 important nutrients that is needed to build strong bones and muscles? Now, write the right answer in the comment box down below, and you can be one of 3 winners to stand a chance to win prizes worth up to 550 ringgit. Now, guys, I'm gonna go ahead and enjoy this yummy drink. Thank you so much, Yanli, for sharing with us the recipe, as well as your tips and advices on what nutrients we can take to build strong bones and muscles. Ladies and gentlemen, we have come to the end of our talk show. Thank you so much for joining us in the segment today on how to guard your bones, brought to you by the campaign Sound Bones, Sound Health by ReGen Rehab Hospital and Anlene Malaysia. I'm sure you guys have learned tips and tricks on how to better take care of your bones and muscles via movement as well as nutrition. Now, I want to thank you guys so much for your participation, as well as a big, huge thank you to the speakers today for lending their time and sharing with us tips and tricks on how to take better care of our bones and our muscles. Now, guys, do not forget to follow ReGen Rehab Hospital social media, as well as Anlene Malaysia social media, to get the latest tips and tricks on how to better guard your bone health. Now, guys, please do remember to take better care of your bones and muscles for better mobility. This is Nazierah signing off. Bye! See you next time.